Okay, now regardless of the type of the brain herniation, increased intracranial pressure can cause a decreased level of consciousness, focal neurological signs, and papilledema. Papilledema is the swelling of the optic disc, which is the point where the optic nerve fibers leave the retina. Also, these individuals can have increased blood pressure, irregular breathing, and bradycardia. These signs are referred to as Cushing'S Triad, and they represent a physiological response of the central nervous system to increased intracranial pressure. Lumbar puncture is a relative contraindication in individuals with suspected increased intracranial pressure due to possible herniations. In order to confirm the presence of a mass effect that can be causing increased intracranial pressure, imaging such as CT or MRI can be used. If CT and MRI fails to prove any mass lesions within the skull, lumbar puncture can be performed. The needle that is inserted into the spinal canal is attached to a manometer, which is a device that can measure and confirm the increased CSF pressure. Treatment of increased intracranial pressure and brain herniation is aimed at reducing the pressure within the skull. This can be done surgically or by using osmotic therapy such as mannitol, which helps remove excess water from the body. Treatment of the underlying cause, such as surgical removal of the hematoma, should also be done. All right, as a quick recap, TBIs occur when a head trauma leads to temporary or permanent brain dysfunction. TBIs can cause extraaxial brain injuries, such as epidural or subdural hematomas and subarachnoid hemorrhage, and intraaxial brain injuries, such as diffuse axonal injury. Sometimes these brain injuries can lead to increased intracranial pressure, which can have various consequences, like brain herniations, which are life-threatening. Diagnosis can be made based on clinical presentation, imaging tests of the brain like CT or MRI, or other techniques such as lumbar puncture. TBIs usually require surgery. Okay, now back to our cases. Christian's head CT showed a crescent-shaped hyperdense mass that crosses the suture lines, which is typical of a subdural hematoma. Due to his age and history of chronic alcohol abuse, he most probably has brain atrophy that led to stretching and rupture of the bridging veins after a minor trauma. Headaches, vision problems and memory loss, slurred speech, and unsteady gait are all common in a chronic subdural hematoma. Now, Max's head CT showed a lens-shaped hyperdense mass that doesn't cross the suture lines, which is characteristic of an epidural hematoma. Also, the fact that they first lost consciousness but then became alert is most probably what we call a lucid interval. Afterwards, the rapid progression to death is also typical for epidural hematomas.